Thank you, Faith. I appreciate that introduction. And again, I'm Sarah Locke from AARP and the Global Council on Brain Health. I thank the Academy and this committee for inviting me to participate because it's a great honor to be here and to have heard the incredible speakers yesterday and my esteemed panel. It's my pleasure to work with you all in a variety of capacities. But I think the very fact that we are having these conversations about how do we create change is an enormous jump in the field, because the conversation about the context for the patient and the context for the caregiver and how they interact with the healthcare system is what we're trying to affect. We've all been at this for many years. I've been at AARP for more than 20 years. And what we have to do is radically spark change. So this is a tremendous opportunity for us to gather and have this conversation, and I am deeply grateful. And I have to say that I've had a great pleasure of working with many groups and organizations with the Global Council on Brain Health who have devoted their lives to this space. And so my remarks are based on my collegial work with hundreds of people who are trying to affect change and improve people's brain health as they age. I think that one of the most important things, even when we're talking about improving care for people who are already living with dementia, is this notion that brain health is something that is actually attainable. I've been working a lot with my colleagues on reducing risk, and that's an incredibly important thing to do. In fact, we're now quantifying the ability to reduce risk up to 40% of dementias could be prevented by modifiable lifestyle factors. I think in this context, it's even more important to say that we can delay onset, and the very same interventions that help you reduce risk improve quality of life for people who are living with dementia and their caregivers. So I really want us to be thinking about managing dementia as a chronic disease in which we can tremendously improve quality of life for people. But there's a big disconnect, and that disconnect is between what providers think and what individuals know. So getting information out about those modifiable lifestyle factors and how you can actually improve change is incredibly important. And AARP recently conducted a survey, and surprisingly large numbers of people who work in this field, healthcare providers, actually know that these things work to improve dementia care. But the message is not getting out. Those are not what we're talking about in lots of academic circles that are trying to improve care. And we need to start taking advantage of that common sense that's not so common sense. Let's get healthcare providers talking about these kinds of interventions that can make a tremendous difference in the quality of life of people living with dementia. And people are hungry for this information. We know based on our surveys that if they knew this information, they say that they are willing to engage in these behaviors. There is a huge disconnect between what providers are saying to their patients because they themselves have a stigma of dementia. And we can't forget that many healthcare providers are younger people. So their perceptions of what older people want are stuck in the perceptions of what they want. We really need to move people off of this reluctance to talk about dementia and instead embrace the fact that they have it and that it is a chronic disease that could be managed. Look at the difference of these numbers. I've highlighted them in yellow. The perceptions that healthcare providers have of if they have to tell someone they have dementia are horribly negative. But if you look at what the people say who are receiving the diagnosis of dementia, they are far less embarrassed or ashamed by this diagnosis than healthcare providers believe they will be. So let's encourage open, honest conversations about what can the health system do for people. So the Global Council on Brain Health has recently released a report on behavior change, because that's what I think we're talking about. Payment reform is very important, and there are incentives that payment can have. But I think it was Bruce who was talking about there are things within the system, even without payment reform, that we can change. And so we have made recommendations for individuals, for communities. And when I'm talking about communities, I'm thinking big groups of actors, healthcare providers, employers, community-based organizations. And I'm going to specify some specific recommendations for communities. But change needs to happen at the policy level as well, and I think we may get into that a little bit more. But we have many policymakers and policy thought leaders with us today, so I look forward to that. But you need first the knowledge, you need motivations. Why should they change their behaviors? And finally, giving them confidence to sustain action so that they can feel like they're moving towards change. So here's briefly a simplified way of the messages we are trying to share with older adults. On the left, we have what are the elements of the pillars of brain health, and on the right, what are the simple steps that people can take to implement those behavior changes. So the actions that communities need to take, there are far too many that I am listing here for us to get into. The most important one is to set a goal to improve brain health. If each group simply said, my goal is to change behavior so that we can improve brain health, that would be a tremendous change, because it's getting away from that stigma that I've talked about a little bit earlier. So thank you very much. I look forward to the rest of the conversation.